Moderna says it's filing an emergency use authorization for its coronavirus vaccine today. It's claiming an efficacy of 94.1% and in severe cases of COVID-19, 100%. CNN Health, so you've been covering the various rollouts of these vaccines and their efficacies. What strikes you about this one?
What strikes me about this one is that it's a much larger data set. We talked a couple of weeks ago when Moderna came out with their first data set. This data set is twice as large, and that gives you more confidence that these numbers are correct, are the reality. So let's take a look at what those numbers are. So what Moderna found is that their vaccine was 94.1% effective in this new larger data set against coronavirus, and it was actually 100% effective against severe disease. In other words, nobody who received this vaccine became severely ill with COVID. Now, let's think a little bit, Allison, about how they got to these numbers, because it's very nerdy and weedy, but it's also very important. So what Moderna did is they took tens of thousands of people, and some of them were given the vaccine, and some of them were given a shot of saline. That's a placebo that does absolutely nothing. Those people then went back to their homes in their own towns and cities, and they were told just to live their lives. Some of them became infected with COVID, some of them didn't. So let's take a look at the effect that the vaccine had. So what they found is that 11 of the 15,000 people who got the actual real vaccine got COVID-19, just 11 out of 15,000. But 185 out of 15,000 people who received the placebo got COVID-19. So 185 people who did not get the vaccine got COVID-19. And again, nobody in the vaccine group actually got severely ill with COVID. Allison?
What ages were in the groups, and also how many shots are required for this vaccine?
Right, so the ages were adults, including some elderly people. And what's interesting is that the elderly people were just as protected as younger people. So people who were over age 65 also were protected 94.1%. So that's really great, because there were some concerns that this vaccine might work well for younger people, but not as well for older people. So that is for sure good news.
Okay, Elizabeth Cohen, thanks for that rundown of what can be a complicated background of some of these vaccines. Great to talk with you.